Hi there. This is Lyndon with David Batsoffen, and I'm David Batsoffen. And today I'm chatting to Willem Dercksen, who is a biokineticist who recently moved into our wonderful suburb. Willem, how are you doing?
Hi, David. Some fun, thanks, and yourself?
All good, thank you. Now that we've moved into level one, things seem to be opening up. People are getting out and about, although we still need to be very cautious. It's not over by a long means, by a long chalk, this particular virus. But that's not why we're talking today. Today, we're talking about one of your specialties, which is spinal injuries. Chat to us about that.
Yes, I found over the past few years that I've kind of created a nice niche for that. I've got a keen interest in the spinal injuries. I've recently had quite a few neurosurgeons and neurologists referring patients to me just because the first step is that they don't want to immediately go into surgery or give someone quite a lot of medication, and it's usually quite strong ones.
Right.
So they rather want to go a bit more conservative and see if one can change their spinal condition through exercises. Usually that's a bit better for the patient themselves, just because any surgery isn't always good, even if it does relieve your pain. But at the end of the day, you still need to go through the surgical process, which isn't always so great. So I have had quite a lot of success with that. Usually it's just by strengthening up the correct muscles and get the person realigned again. And that usually does the trick. It's only when it's very, very severe and quite an obvious injury that only requires surgery that you don't need exercises. But so far, most neurological back issues and neck you can solve by just correcting their posture and also getting some good exercises in.
Why is it that, pardon me, we as humans don't take better care of our backs?
I think it starts off when you're younger, when you think you're unbreakable and you're half Superman, that you can still lift things improperly and you're just punishing your back while you're still young and fit. But definitely when that starts getting more and more repetitive, how can I say, incorrect lifts and time goes on, it does catch up with you. So then most of the time people tend to take better care of their backs.
Why is it that people don't want to lift with their knees? They'd rather bend over and really, really strain. Whereas if you squat down on your haunches and then come up with the item, whatever it is that you're trying to lift, it's usually much easier. And as you say, less stressful on your back.
No, definitely. I think people are overall just like in quite a lot of rush. So they're in a hurry, so they just want to pick it up as quickly as possible. And obviously that goes hand in hand with a bit of laziness as well. So they don't want to go into that correct posture and lift it up. So yeah, that plays a big role. But like you said, using your legs, your knees, that's so much better than putting all that force through your poor back.
Yeah, and as you say, we're no longer, when you get to a certain age, you're no longer 10 foot tall and bulletproof. And back surgery is very, very serious because there is a lot of opportunity to make mistakes, and then you end up worse off than you were before you started. And I don't know about your feelings, but I know for people that I've spoken to, back surgery is always an absolute last resource.
Yes, definitely. Like you said, just one slip of the hand and things can go quite horribly wrong. But luckily, surgeons are there for a reason. They are great. But yes, if you can rather do exercises than go into surgery, that's always your first bet. Um, Surgery is always a bit of a gamble, but it does turn out to be good, but I'll always rather recommend going conservatively first, and then at least if all absolute fails, then go for the surgery, because then that is your last option. And anyways, rather start with a few more options than starting with the last one.
True enough. Do you find that that young backs are more resilient and respond better to your treatment than older people?
I think, yeah, just the younger the person is, the better they will respond to exercises, just because their bodies are still forming, and you don't have any additional injuries, for instance, or you're not so stiff from years and years of incorrect sitting or behavior. But it isn't always the case. It really depends on the injury itself. So there is, even if you are on the older side with the correct exercises, it might take a bit longer, but you'll still get to the same results.
So what sort of exercises would you suggest people do, both after coming to you and maybe in order to prevent being in a situation where they need either surgery or your services for that matter? They can make certain that they look after their back and make it work longer than they thought it might.
Yes, I think it is difficult if you, from the get-go, if you're not very, how can I say, clued up on how to protect your back. So say if it come to my practice and we educate the person on how to do correct lifts, how to sit properly, especially like our previous video with the office ergonomics involved as well.
Right.
There's a lot of education involved, and also training the specific lifting techniques. That does help. So if you can just replicate that, it will help you when you leave the practice and do your normal daily activities. Any of the exercises that I'll demonstrate during our session is always good to do back at home, just to prevent it and just keep the body strong and supple.
Right. And these are exercises that need to be done on a regular basis, I should imagine. It's not just a one-off and then you go, I'm fine. You know, it's like, I think we've discussed this before, Willem, where people take medication and it's a course of medication and they get halfway through, they feel good, they go, we don't need to finish the course. And of course, it doesn't work quite like that. And I should imagine exercises are the same. If you're told to do an exercise every day for a certain length of time, then you need to make time to do it.
Yes, definitely. Because I know life happens and people get very busy, and after a long day's work, you are quite tired. But optimally, it would be the best if you can exercise every single day, just for that specific amount of time. Like we said, half an hour a day even is plenty. If you can keep the frequency up in terms of doing it, by doing it every single day, every little bit is better than nothing.
And what should people be looking out for, again, pardon me, as regards signs that they may have a spinal injury of some sort?
Yes, I think the sign and symptoms that you just need to be aware of and have a look at is if you start noticing any kind of pain that radiated, that comes from your spine. So whether it's from the neck or all the way down to your lumbar area or the lower back, usually it's like sharp shooting pain, which normally indicates a nerve impingement, burning sensation, or just a general numbness around the lower back kind of area. They call it like the band pain. Any of those type of symptoms, it's usually like a numbish pain that you have there. All of those do indicate different kinds of injuries to the back, whether it's structural or just stiffness, ligaments that are too tight. Yeah, just a few of those symptoms, especially if it also starts interfering with your daily activities. Like you don't want to pick up your kid anymore, you don't want to bend down to grab something, put on your shoes, for instance, getting in and out of a car, going upstairs, those type of things. Daily activities that starts to decline because of guarding the back or purely just solid pain in the back. Usually you will also notice that if you say have the mechanism of injury also plays a big role. Say if you did actually fall, then you know, all right, so it was due to the fall that I've injured my back. The pain doesn't go away, then you know you have a problem. Definitely, that's like the most obvious way of knowing that you do have a back injury. But most people don't have a mechanism of injury. It just creeps up over time, and then one morning you wake up and this stiff back just doesn't want to go away. It doesn't matter what you do. So yeah, those are some signs and symptoms that you can look out for.
And I suppose at the end of the day, it is all about being proactive. So if you oh, frog in my throat today. Being proactive, and if you believe that there's a problem, rather let them come and visit with you, and then you can either say yes there is, or no there isn't, or you may be able at that particular point to say there is a problem that is about to occur, and luckily you've caught it early.
Yes, definitely. Like it's much easier to treat a small problem than to treat multiple big problems. You know, sometimes that problem has been with a person for so long, it's almost irreversible, and that's obviously the worst case scenario. So if you do notice things are getting into the chronic stage or long-term pain, then you know you have to sort this out, because it's not going to just go away overnight. Um, so yeah, like you said, rather nip it in the bud early, get it out of your life, and then yeah, it's much easier to treat.
Yeah,
From a bio's perspective.
Yeah, two tablets at night is not going to make it all just vanish instantaneously, unfortunately.
No, unfortunately, today everyone wants a quick fix. So unfortunately, that doesn't exist, and it's also not sustainable. Unfortunately, medication helps a lot. It's a miracle drug, but it's not sustainable. So you have to try and treat the primary problem first, and then you'll be on your way.
Great stuff. Willem, if people want to talk to you about a back issue, how do they contact you?
Yes, I think the easiest way to contact me is just via my cell phone, or just my contact number, which is 076 87 08 031. And then from there, we can just make an appointment, and then I'll try and help you as much as I can.
Great stuff. That number, once again, 076 8708 031. And as Willem and I were saying now, rather go sooner than later. Don't leave it till the last minute, because at the end of the day, your back is your only support. And you want to be able to your back to say, I've got you.
Yes. No, that's 100% true, David.
Great stuff. Willem, always good to talk to you. Willem's number, once again, and he's right here in Linden, 076 8708 031. Willem, great to have chatted to you. Take care, be safe, be healthy.
Perfect. Thank you so much, David. Thanks for having me.